At 20 through, now I'm 31, but I did not have the funds to pay for $10,000 types of therapies that my kid needed. Even once I got married and had a second income, it's definitely not enough. And so this past summer, after the culmination of, being a 16-year-old male on top of having the intellectual capacity of a 4-year-old and several other mental illnesses that he struggles with, combined with COVID-19 related, isolation-related depression, my son started getting very aggressive in the home. I have 2 younger children. I reached out directly to Community Services Board and left a message with someone that was supposed to be my point of contact. His voicemail at work was full, so I called his cell phone, crying, and I said, my son is being violent in the home. It's emergent. I really need some help. We need some resources. They did not call me back. I emailed a supervisor a couple weeks later asking for a follow-up and never got a call back or an email back. So I Googled what to do, and I came to Reach's crisis hotline, which I had never heard of despite living in Virginia my whole life and having my son. So I called this hotline. It said services were free regardless of Medicaid status. So their, not suggestion, because when they thought we weren't going to comply, they sent the police to our house. But they told us to take him to the emergency room. And that just didn't make sense to me. I have protected him most of his life, all of my adult life, and so just dropping him off there or taking him in and telling officials, he was violent, didn't seem safe to me. But we went, and we were required to stay with him in the ER, one parent, 24 hours a day, in a bare minimum room that had one sheet on his bed, no pillow. He wasn't allowed to wear clothes. He wasn't allowed to have personal effects, which he's also autistic. So if you know anything about that, it would drive me insane. It did drive me insane, and I got breaks with my husband. But my son had to sit in that room in the bed for 8 days while we waited for a bed for an adolescent to open up, which one finally did at Commonwealth, and I think it actually happened in July. We talked about that. And he went there for a week where, they adjusted his meds, which I guess his doctor could have done. And then afterwards, we were referred again to CSB, where we got a different caseworker. We went to the intake and the intake alone and got a bill for $2,000 because he doesn't have Medicaid. And while they haven't followed up with me about I shouldn't have that bill, they have followed up with me to pay it. So, Community Services Board, I know some good people that do work there, and I know that our mental health care system overall is overworked, which is why we need this funding. The follow-up care since has been a reach worker coming into our home, and that is free of charge for prevention services. But then at the end of that, because we don't have Medicaid, we're right back where we started. And all they did was adjust his meds and charge me a bunch of money for it.